The first quarter of the year is behind us. We've seen January, Cervical Cancer Awareness Month, February, World Cancer Day, and March, International HPV Day, all providing great platforms to take the message on cervical cancer to our communities, to our policymakers, and especially to girls and women that need to know how they can prevent cervical cancer. Today, we're asking what role should clinicians play in driving national advocacy across Africa. This is Julie Torode working with IGCS and speaking with Dr. Khadija Warfa, a gynecologic oncologist based at the Aga Khan University in Nairobi, Kenya. Welcome, Dr. Warfa.
Thank you so much, Julie.
Khadija, in the lead up to Access Africa in Cape Town at the end of 2025, we conducted a survey of IGCS African members working across disciplines in the field of cervical cancer. What stood out for me was that despite the fact that 100% of respondents were behind the call to action, wanting all countries in Africa to have operational cervical cancer elimination strategies in place by 2030, clinicians did not see themselves as the catalyst or leaders of advocating for this to happen. What's your take on that, Khadija?
Well, Julie, as a clinician working in this continent, advocacy is not something we are trained to do. We wear multiple clinical hats that sometimes take a lot of our time. And so many might say they do not have the time to add advocacy work on top of their clinical duties. Well, in practical terms, clinicians are involved in the diagnosis and treatment of cancer, and many colleagues might say that advocacy is outside their scope of clinical work and is a responsibility, and I say quote unquote others. And sometimes we might push this responsibility to public health professionals or the government or NGOs. In addition, once you're an advocate or being an advocate, it means you have to raise your voice and you have to speak about things that need to be said. In the African context, this might seem to criticize the institution that you work for or the government. So many might feel uncomfortable taking up these advocacy roles. And perhaps what we do not realize is that the public and the government would appreciate our expert opinion, which would bring clarity to otherwise confusing scenarios, such as cervical cancer vaccination, what screening tests should be done, or what are the signs and symptoms of the disease.
Okay, so let's unpack that a little. I'm picking up on two themes here. At the forefront, concerns about personal and professional risks, perhaps reinforced by institutional barriers, but also a clear training and knowledge gap. Do you agree, Khadija?
Yes.
Okay, so let's take them one by one. From the perspective of personal and professional risks, this could be a fear of a backlash, being labeled as disruptive or difficult by colleagues and peers, even superiors, but also maybe a risk to your professional credibility. Do you have an example yourself, Khadija, and how do you think your peers could reduce these risks?
I agree, Julie. Most institutions, whether public or private, have a hierarchical system. Junior colleagues who are enthusiastic and want to add their voice to improve our health system, such as appearing on public fora, can be labeled as being disruptive or too political. So what can peers do? They can actually reduce this by working together, using a collective voice to normalize advocacy, and working through local professional bodies to engage with policymakers and packaging the message in line with data and guidelines. And this would boost the credibility of the message and the messenger so that nobody is picked as being the disruptive, but rather an example in Kenya would say the Kenya Society of Hemato-Oncology advocates for cervical cancer screening. These are the screening guidelines we recommend. And thereafter, the Ministry of Health would take it up, and then it becomes a norm for the whole community. And as an example, I work in a private hospital that has an excellent communication team. So we're encouraged to appear on both print and broadcast media to share strong health messages with the public. So we have to write something, and it's published on the newspapers in Kenya. A lot of colleagues appear on the news. So I would encourage clinicians who work in organizations to actually approach the institution they work for and say, can they have a more proactive stance on advocacy? And this would improve messages to the community.
These are great tips, Khadija. Thank you. What do you say to colleagues that talk about not having time for advocacy or feeling that they don't have the institutional support that you've just described?
So clinicians have a lot of demands on their time, and especially in this context, if they have to have teaching commitments. So WHO has recommended a patient-doctor ratio, but unfortunately in sub-Saharan Africa, our ratio is 1.8 physician per 10,000 people. And if you add what I label as shadow work, includes the administrative task, teaching, setting and writing exams, documentation. This actually reduces the patient or clinical time that you have. So if you add the mental and sometimes emotional strain of this workload, I think we can appreciate that you just do not have another bandwidth to add on to advocacy. And this might be compounded by also restrictive policies in some institutions. And this might leave colleagues feeling muzzled and unable to speak out. My view is that I learned so much by being an advocate, working with the community, and also important for clinicians to recognize that improved national strategies and implementation will help us to be more impactful as clinicians. And I'm sure none of us would want to see or usually see patients with advanced cervical cancer, where our skills as a surgeon are sadly no longer able to cure. And the strategies that identify this disease at an early stage, where clinical interventions can cure, and well, I must say this is worth advocating for.
Absolutely. I would say patients, clinicians, and politicians are united by that ambition, Khadija. The second area you touched on was the knowledge gap and training need. Advocacy, especially at a system or policy level, leaves many feeling inequipped to act effectively. What do you say to those colleagues?
So during the Access Africa, when the survey was done, many members actually revealed that they're unaware of the strength of the clinician's voice and are also not experienced enough to know about how to go in terms of how should we engage our policymakers. So the IGCS is developing a 2-pager document which is going to accompany this podcast as a first step to encourage clinicians to understand how they can add value. And I like the very easy 10-step format as an entry point on how to become more active. So it gives you a breakdown of how to become an advocate.
Yes, I think it'd be a great resource for those really worrying about how they might get started. And let's just be very clear, policies are more effective when clinicians are involved because they improve the policy feasibility and relevance, they increase the public credibility and trust. I'm sure they reduce implementation failures and also make sure policy decisions are aligned with real patient needs. So let's encourage everyone to have a look at that resource. So, Khadija, Kenya launched its national cervical cancer elimination strategy in January. Congratulations on being one of the only 7 countries in sub Saharan Africa that has one. Does your national plan address ongoing advocacy?
Yes, first I congratulate the Kenyan team who are behind this national strategic document. And the plan has envisioned for the next 5 years, it has advocacy, a strong advocacy component. And particularly this is in terms of the community health work engagement, what targeted messaging should be sent out to the community, the political and strategic advocacy. And this will ensure the healthcare worker has a framework for advocating for our 47 county level leaders to ensure implementation of the national strategy. And this is a great example to where clinicians can add value to the local advocacy efforts. Professional organization, patient advocacy groups, civil societies will also be working to ensure that the national strategy is implemented. We benefit from that and should be working alongside them for rapid adoption. Access Africa also highlighted the opportunity to learn from country experiences. And as an IGCS community, we should be sharing our success and our failures so that others can learn from them. Clinicians would be the strongest vehicle for that sharing and carry the ideas and solutions to their own policymakers.
Thank you, Khadija, for those insights. One last question to you. We're convening again at the IGCS 2026 meeting in Montreal. What progress would you like to report from Kenya in this regard?
So on a personal level, I will be excited to report that this 2026 is going to be a year of protecting our women in Kenya and Africa as the new national strategy gets rolled out. Cervical cancer is preventable, and we have to leave our own personal comfort zones and advocate to get the message out to our communities. And then following on from the Access Africa meeting, I would love to be able to report that we now have continental ownership of the ambition to eliminate cervical cancer as a continent for the first time. And we have a network of IGCS members who are actually maintaining continuous momentum and creating a political attention which will allow eventual realization of cervical cancer elimination.
Well, we look forward to seeing your predictions realised when we meet again in Canada. This is Julie Torode reporting for IGCS. Thank you, Dr. Khadija Warfa, for this interview, and wishing you and your national partners an impactful year as you implement the new National Cervical Cancer Elimination Strategy for Kenya.
Thank you so much, Julie.